Good morning to all. I am Subarani, Associate Professor in Emmanuel Research College of Pharmacy. Today's topic is Oral Rehydration Solution. The topic name is ORS, Oral Rehydration Solution. Some introduction. In worldwide, diarrhea claims several million lives annually, mostly those of infants. So, poverty, crowding, and contaminated water supplies all contribute. Almost all of these deaths could have been prevented with adequate fluid replacement. Incidence is much lower in developed nations but remains one of the two most common reasons for visits to pediatric emergency departments. Then, more than 5 million children under the age of 5 years die every year due to diarrhea. In world, more or 5 million children under the age of 5 years die in this problem. So, means diarrhea problem. But in India, more than 1 million children get killed by this miserable disease known as diarrhea. But in India, more or less 5 million children in world, but 1 million, more than 1 million children get died in India. Okay, before the advent of ORT, oral rehydration therapy, death from diarrhea was the leading cause of infant. This diarrhea is affected more than in infant. Between 1980 and 2006, with the introduction of ORT, infant deaths worldwide have decreased the number of from 5 to 3 million per year. So, 5 million children affected in diarrhea and 1 million children affected in diarrhea in India. In between 1980 and 2006, the introduction of ORT, the infant deaths worldwide have decreased the number from 5 to 3 million per year. What is diarrhea? Increases in volume or fluidity of stools, changes in consistency, and increased frequency of defecation is known as diarrhea. Increases the volume or fluidity of stools, changes in consistency, and increased frequency of defecation. So, the blood in stool indicate an acute diarrhea, illness, or dysentery irrespective of frequency. So, blood in stool indicate an acute diarrheal illness, that means dysentery, or irrespective of frequency. In World Health Organization noted, passage of loose or watery stools at least 3 times in a 24 hours period. So, World Health Organization noted the definition of diarrhea is passage of loose or watery stools at least 3 times in a 24 hours period. Diarrhea disorders are divided into 2 types. First one is acute diarrhea, 3 types: acute diarrhea, persistent diarrhea, and chronic diarrhea. The diarrhea disorders are divided into 3 types. They are acute diarrhea, persistent diarrhea, chronic diarrhea. First one is acute diarrhea. The most usual form of diarrheal illness have an abrupt onset or resolve within 14 days and are mostly caused by infections. The acute diarrhea is most usual form of diarrheal illness. Then second, persistent diarrhea. Diarrhea which persists for longer than 14 years. First acute diarrhea in 14 days, within 14 days, then persistent diarrhea is for longer than 14 days, then chronic diarrhea. Duration of symptoms is longer than a month. It is obtained in longer than a month. So, the differentiation of acute, persistent, and chronic diarrhea is acute diarrhea within 14 days, persistent diarrhea longer than 14 days, then chronic diarrhea is longer than a month. Okay. Next, physiological basis of using ORT in diarrhea. Physiological basis of using ORT in diarrhea. Sodium passes into epithelial cells by co-transport via the SGLT1 protein. So, sodium passes into epithelial cells by co-transport via the protein SGLT1 protein. Okay, sodium passes the epithelial cell. From the intestinal, sodium is pumped by active transport by the sodium potassium pump. For the intestinal, then the sodium is pumped out by active transport pump. That means sodium potassium pump, Na plus K plus pump through the extracellular space. So, from the intestinal, sodium is pumped to active transport by the sodium potassium pump through to extracellular space. Then the sodium potassium ATPase pump moves 3 Na plus ion in exchange for 2 K plus ion. So, the sodium potassium ATPase pump moves 3 Na plus ion in exchange for 2 K plus ions. Then this creates a downhill sodium gradient within the cell. It forms a downhill sodium gradient within the cell. Then SGLT protein use energy from sodium gradient to transport glucose into the cell against the glucose gradient. So, the SGLT protein use energy from the sodium gradient to the transport glucose into the cell against the glucose gradient. Okay, this is the physiological basis of ORT in diarrhea. Then the GLUT uniporters then transport glucose across the membrane. The first of a GLT proton, then second one GLUT uniprotein, then transport the glucose across the membrane. Then SGLT1 protein requires 2 Na plus ion to co-transport 1 molecule of glucose. So, as galactose, it means as galactose. Without sodium, intestinal glucose is not absorbed. Without sodium, the intestinal glucose is not absorbed. So, this is why oral rehydration salt include both sodium and glucose. For each cycle, hundreds of water molecules move with the epithelial cell slowly, then rehydrating the patient. Okay, then for each cycle, hundreds of water molecules move into the epithelial cell, then slowly and rehydrating the patient. Okay, then oral rehydration therapy. Most diarrhea related deaths in children are due to dehydration. So, most of the diarrhea related deaths in children are obtained in dehydration. Loss of large quantities of water and electrolytes from the body in the fluid stool. So, loss of large quantity of water and electrolytes from the body in the liquid stool. Many of these deaths can be prevented into the use of oral rehydration therapy. So, many of these deaths can be prevented with the use of oral rehydration therapy. The oral rehydration therapy is a type of fluid replacement used as a treatment for dehydration. The oral rehydration therapy is a type of fluid replacement therapy. It is used as a treatment of dehydration. Oral rehydration therapy is mainly used as the treatment of dehydration. It involves drinking water mixed with sugar and salt and other home available fluids while continuing to eat. So, the oral rehydration salt involves drinking water mixed with sugar and salt and other home available fluids while continuing to eat. Then history of ORT. Over 2500 years ago, Sushruta described the treatment of acute diarrhea with rice water, coconut juice, and carrot soup. So, in 2000 years ago, Sushruta, she is described the treatment of acute diarrhea is used as rice water and coconut juice and carrot soup. Okay. Then 1831, William Brooke treated cholera patient with the 4 fluids, reducing mortality from 70% to 40%. Within 1831, William Brooke treated cholera patient in the mortality from with the 4 fluids, reducing mortality from 70% to 40%. Okay. Then fluid replacement became the standard of care for moderate or severe dehydration for over 100 years. So, the fluid replacement became the standard of care for moderate and severe dehydration for over 100 years. Late 1950s, Dr. Hemendroth Chatterjee, then 1971, Dr. Dilip Mahalan Nabis, 350,000 treated with mortality of 0.36%. So, these are the history of oral rehydration therapy. Next, oral rehydration solution. So, as soon as diarrhea starts, it is essential to give the child extra drinks to replace the liquid being lost. So, diarrhea starts, it is essential to give the child extra drinks to replace the liquid being lost. Okay. Oral rehydration solution is the cheap, simple, and effective way to treat dehydration caused by diarrhea. The oral rehydration salt is cheap and simple and effective way to treat the rehydration caused by diarrhea. ORS drink contains the main elements that are lost from the body during diarrhea. Effective in treating dehydration resulting from all types of acute diarrheal diseases. Then ORS drinks should be given to the child every time a watery stool is passed. Okay. Then these are the oral rehydration salt packet. Then principle of ORS. The oral rehydration salt principle. Glucose, when given orally, enhances the intestinal absorption of salt and water. The glucose given orally enhances the glucose when given orally, it enhances the intestinal absorption of salt and water. Thus, it can correct electrolyte and water deflect. So, it can be correct the electrolyte and water deflect. Whom can it be given? It given in all age groups. In what condition can it be given? In all etiologies and all countries. So, all the age groups are given to the ORS, and which condition can be given? That means all etiologies and all countries. Okay. Then types of ORS. Sodium bicarbonate based ORS, trisodium citrate based ORS, reduced osmolarity ORS, and sugar ORS. So, the types of ORSs: sodium bicarbonate based ORS, trisodium citrate based ORS, then reduced osmolarity ORS, and super ORS. These are the types of oral rehydration salt. Then first one, sodium bicarbonate based ORS. Composition. Which chemicals are present in the sodium bicarbonate based ORS? Condense and gram. First of all, sodium chloride, NaCl, it present in 3.5 gram. Then glucose, it is present in 20 gram. Then KCl, potassium chloride, 2.5 gram. And sodium bicarbonate, 2.5 gram. So, these compositions, these chemicals are presented in this composition in sodium bicarbonate based ORS. Next one is trisodium citrate based ORS. Trisodium citrate based ORS. The composition of chemicals are sodium chloride 3.5 gram, then glucose 20 gram, then potassium chloride 1.5 gram, then trisodium citrate 2 grams. So these reagents are presented in the trisodium citrate based ORS. These are the composition of these chemicals present in the trisodium citrate based ORS. Then bicarbonate versus tricitrate ORS. The comparison of bicarbonate ORS and tricitrate ORS. Bicarbonate based ORS, it is less stable. These bicarbonate ORS are less stable. Stool output not reduced. The stool output is not reduced. Then tricitrate based ORS, it is more stable. Tricitrate based ORS is more stable. Then less stool output in less stool output in high output diarrhea. Trisodium citrate increases intestinal absorption of sodium and water. So these are the comparison of, so the differentiation of bicarbonate ORS and tricitrate ORS. Then World Health Organization, the ORS osmolarity is Na plus ion in 19 millimicron and Cl plus is 80 mm, then glucose is 110 mm, then potassium ion K plus ion is 20 mm, then citrate is 10 mm, and total it is present in 310 mm. Okay, in World Health Organization mentioned the ORS osmolarity is this value. Okay, then any adverse effect of this World Health Organization ORS? Yes, it is possible adverse effect in hypertonicity is not fluid absorption. The hypertonicity is not observed in fluid absorption. How to overcome which method is used as? We should reduce the osmolarity of the ORS. So we reduce the osmolarity of ORS. Okay, then reduced osmolarity of ORS. The composition is sodium chloride is 2.6 gram, then glucose is 13.5 gram, then potassium chloride is 1.5 gram, trisodium citrate is 2.9 gram. Okay, then reduced osmolarity of ORS is these values. Okay, then osmolarity of this new ORS, for example Na plus 1, then 75 mm, Cl chlorine minus 65 mm, then glucose is 75 mm, then potassium K plus ion is 20 mm, then citrate is 10 mm, then total 245 mm is osmolarity of the new ORS. Okay, then advantages of low osmolarity ORS. It is increased efficacy of ORS in non-cholera diarrhea. Then it is needed for unscheduled supplement therapy in children fell by 33%. The stool output decreased by 20%. Then vomiting decreased by 30%. It is used as safe and effective. These are the advantages of osmolarity of ORS. Okay, then dosage of requirement. The ORS dosage and the requirement. If the child weight is known, okay, then the total amount of ORS solution for rehydration during the first 4 hours may be calculated as 75 milliliter per kilogram. Okay, first of all, age, weight kilogram, then solution milliliter, then greater than 4 months, then weight greater than 5, the solution is 200 to 400, then 4 to 11 months 5 to 7.9, then the solution is 400 to 600 ml, 1 to 2 years 8 to 10.9 weight, so the solution is 600 to 800, then 2 to 4 years 11 to 15.9, the solution is given as 800 to 1200, then 5 to 14 years the weight is 16 to 29.9, then the solution gives us 1200 to 2200, then less than or equal to 15 years, and then weight is less than or equal to 30, 2200 to 4000 ml is used as. Okay, then how to administer? Wash your hands with soap and water before preparing solution. Then prepare a solution in a clean pot by mixing 1 packet of oral salt, okay, with 1 liter of clean drinking water. Stir the mixture till all the contents dissolve. Wash your hands and the baby's hands with soap and water before feeding solution. Then give the sick child as much of the solution as it needs in small amounts of frequency. Okay, then give child alternately other fluids such as breast milk and juices, etc. Continue to give solids of child in 4 months. If the child still needs ORS, after 24 hours, make a fresh solution is used. ORS does not stop diarrhea, it prevents the body from drying up. The diarrhea will stop by itself. If child vomit, wait 10 minutes and give the ORS again. Usually vomiting will stop. If diarrhea increases and our vomiting persists, take child over to a health clinic. Okay, rules. In greater than 2 years, give 1 to 2 teaspoons every 2 to 3 minutes. Then older children offer frequent sips out of a cup. Then adult used the ORS powder, drink as much as they can. Give the estimated amount within 4 hours. If the child vomits, wait for 10 minutes. Give a teaspoonful every 2 to 3 minutes. Okay. If the child wants to drink more than the estimated amount, no harm, give more. If the child refuses to drink, see whether the signs of dehydration has disappeared. If yes, treat similar to non-dehydrated diarrhea child. If the child is breastfed, nursing plus treatment with ORS solution. Non-breastfed infants less than 6 months. Along with ORS solution, give 100 to 200 ml of clean water for first 4 hours. Okay, ORT program first started in 1986 to 1987. It is implemented through RCH program. ORS packets are supplied by the central government. Twice in a year, 150 packets of ORS are provided as part of drug kit. It is applied to all sub-centers into the country. So achievements and benefits. It is low cost treatment of the patient in our homes. Ingredients are inexpensive and readily available. Drinking water is sufficient. So breakthrough in the fight against cholera and the diarrheal diseases. Mortality rate in cholera has been reduced to 0.11% from 9.3%. Okay, these are the notes for oral rehydration therapy. Okay, students. Okay, thank you.